3 years ago, I started RingMD after I was traveling through Southeast Asia. And during my travels, I saw such a huge lack of access to healthcare. And so for me, originally, I founded RingMD with the mission to connect every person on the planet to affordable healthcare. In our mind, the only way that we can really bring access to healthcare to every person on the planet is through the use of technology. Traditionally, access to healthcare is visiting a doctor in person. However, through the use of the technology that's available today, you can now see a doctor from the smartphone in your pocket.
Today, the healthcare industry is challenged with a number of things. Particularly in Asia, we do not have enough doctors, we do not have enough number of beds. So Asia is very quickly getting older. And as we have people getting older, the demand for healthcare services is much, much higher now. So as we think about how we still have limited number of doctors, limited number of nurses, what we think about is how do we bring care without necessarily expanding the capacity we have. And that's where virtual care changes the way we do that.
It's easy to imagine in Australia the use of a telehealth platform in a remote and rural setting. Australia is a very large country with a very small population which is sparsely spread. So it shouldn't be the case that only those in the rural and remote setting have immediate access to care. The provision and the requirement for immediate access to care is just as valuable in a city as it is in the countryside. So our perspective on that for Australia is using what we know and love in Australia, which is technology to make distances shorter, to provide that technology, almost democratise that technology so the provision of healthcare is faster, the delivery of healthcare is more meaningful, more rapid for people nationally. What excites me is a couple of things. Firstly, we're talking about a part of the world within which we're seeing very, very significant increases in chronic disease, in addition to the existing burden of communicable disease. So the question that I've got, and really what makes me passionate about healthcare in Asia Pacific, is how do we take the learnings from those established markets where we've addressed those challenges before and transport them into the emerging market context. So established learnings, new markets, to really drive better outcomes in healthcare in a much shorter period of time. If we think about the WAC's vision for the provision of healthcare in Asia Pacific, it's very, very clear, and we know it's aligned with our innovation lab partners. And that's to provide meaningful, credible, immediate access to healthcare for every man, woman and child in Asia Pacific, irrespective of age, location, or access to physical or financial resources.
Microsoft plays several roles in accelerating the mission that we have around virtual care. The first one is just aggregating all of these really awesome companies in a single location. Because what we're able to do, we're able to provide them with some of our technologies, particularly the advanced technologies like IoT, advanced technologies like conversational platform, and so forth. It is to bring together an ecosystem of partners that range from pharmaceutical companies, medical device industries, the academia, and the investment communities, to look at how do we accelerate innovation, and then look at how do we as Microsoft take some of this innovation, apply that, and leverage our sales, marketing, and distribution engines that we have today. What excites me most about the virtual care in particular is how we can actually provide healthcare to half the population of Asia that currently do not have access to care.